Welcome back. It's week 2 critical care residency. Okay, so let's try that again. Welcome back. It's week 2 of my critical care ICU residency. Today is Friday. I've already done all of my Zoom classes for the week and I am heading in for my first shift on the unit. I have no idea what to expect. I don't know if I'm gonna get an orientation today. I haven't been oriented to the floor yet, or if they're just gonna throw me in and I'm gonna have patients. I know I'm gonna meet my preceptor today, but I don't know if I'm gonna be working with him. So I guess I'm gonna find out when I get there. I don't know what he's gonna expect of me or really what it's gonna be like at all. So I'm really excited, really nervous. I just really don't know what they're going to expect or what they expect me to know or what they expect me to do, how much I'm going to do today. So I don't know how much I'm going to be able to film when I'm actually in the hospital, but I'm going to try and capture as much as I can. And of course, later on in the video, I'll tell you guys all about the classes that we did this week. Just got in my car. I officially made it through my first day and it was awesome and intense and a lot of information. I have a great preceptor. He's like amazing. I mostly just shadowed today, but what was surprising to me was the fact that I had COVID patients. Like, I wasn't expecting that. I don't know why, working in the ICU. It was just kind of surreal, but I'll tell you guys more about it a little bit later in the video. I couldn't really get that much footage because I'm not really allowed to take my phone out on the floor, but I'll try and sneak some videos here and there. Week 2. So I know I talked a little bit about my first day, but I felt like my thoughts were all over the place. As you guys know, I did have my first shift on the floor. Overall, I think it went really well. My preceptor is great. The first day, I honestly just shadowed. It's just a lot to take in on a first day. You don't know where anything is. You don't know where the sheets are, where the Pyxis is. Your badge doesn't scan. You can't get in everywhere. There's still like a lot of kinks to work out. So I feel like on the first day, I just kind of got acclimated to the floor, learned where things were, met everybody that was working that day, and just kind of shadowed my preceptor. And the cool thing about it was that I got to see what you actually do on a shift as an ICU nurse, because that was my first experience in the ICU ever. I never did a clinical rotation there or shadowed anyone on the ICU. I went into that shift kind of blindly. So it was really awesome to get to watch him do what he had to do and then also be able to ask questions and not feel bad about it. So overall, it was a really great experience. I think the unit that I'm working on is an amazing place to learn. All of the nurses are super helpful and like willing to help. So that really makes your transition a lot easier when you know you have people that are there and they're, you know, willing to support you. So just like last week, I have my laptop here and I'm gonna go through my schedule. I did have classes Monday through Thursday, 8 to 5, and then my first shift was on Friday. So on Monday, we did hemodynamic principles and hemodynamic monitoring. And if I'm being completely honest, I don't feel like I really understood the concepts very well, but I haven't really been exposed to arterial lines and central lines and things like that. But it was good to at least get exposed to it. And then when I am on the floor, I can start to piece those things together. On the next day, it was pretty much cardiac focus. We talked about acute coronary syndrome and heart failure in the morning, and then in the afternoon we did a lecture that was all about sedatives and analgesics. So we went into drips like propofol and things that you're gonna see in the ICU that you typically wouldn't see on a med-surg floor. So the thing about being in the ICU as a nurse, you have a little bit more responsibility because we titrate our own drips in the ICU. So if you're on a med-surg floor, you won't see a patient that's on a drip that's gonna be needed to be titrated. That's kind of one of the criteria that would differentiate a patient being in the ICU versus med-surg. So that lecture was just about those very important different meds that are very common that you're gonna see on the floor, and what are their starting doses. How do you titrate them? How often can you titrate them? What are you looking at? Are you looking at the map? Are you considering the RAS? So it was a really, really awesome lecture. I actually enjoyed it a lot. But again, it's one of those things that I understand in theory, but I think that the more hands-on experience I get, the more I'll feel comfortable with that. So the next day was what they call a new grad core day. So this is a day focused on new grads, and it's just classes trying to help you to transition into the hospital. It's not really so much about patient care, but just different things on how to transition into your new position. And then after that, in the afternoon, we had a debriefing session where we break off into small groups, still on Zoom, and we meet with one of our leaders of the program and we talk about what's going well, if we have any questions, if we have things that maybe aren't going well, we're able to share it with them. And it's kind of like our own time to vent and have no judgment. Also talk to other new grads because we really don't see each other. So it's kind of nice to be able to vent a little bit or share your experience, hear how other people's experiences are going. So the next day, which was my last lecture day, we continued with more cardiac lessons. So the morning was all about pacemakers, just like a general overview, nothing too in-depth, basically how they work, what kind of patients are a candidate for a pacemaker, and things like that. And then in the afternoon, we did a session that was all on cardiac pharm. I really enjoy the lessons that are on pharmacology because they're focused on like very specific meds that you know you're going to see on your unit. You know, when you're going through nursing school, they really overload you with medications. I mean, you have to learn pediatric, OB, psych meds, like things that you're really probably never even going to have to use because you're not going to even be in that specialty. So I feel like you just have so much information in your head. So the cool thing about this program is that we do go through very specific pharm and different medications that you're definitely going to see on the floor. So you're starting to get familiarized with them. And then when you do see them on the floor, it's like, oh, I saw this, and then it all starts to get pieced together. And then, of course, my last day was my first shift on the unit, and I think it was a great day. I'm just really looking forward to getting more time on the unit and learning. I have a lot to learn, and I think the only way that I'm going to learn is by getting that hands-on experience that I really didn't get when I was in nursing school because of COVID and doing everything online. So I'm just really looking forward to that. I know there's going to be a lot of growing pains. I know it's going to be really tough. I know that there's going to be days that are going to be way harder than others, but I'm just looking forward to taking a step forward and feeling more confident on the floor, feeling more confident as a nurse. I honestly feel like there's nothing anyone can say that can really prepare you for this. When I first made this channel, I was like, I want to share this experience so that I can help other people that don't really know what to expect who are going into this field. But I'm very quickly learning that there's really no way to prepare. You just have to kind of get out there and be exposed to different things. You really just have to get experience. You have to work with different patients, work with different nurses, and there's really no way to be prepared. The best way to be prepared is to just go out there, get the experience, learn as much as you can, and ask questions, take notes if you have to. I think it's just one of those things that I'm just gonna have to get out there, put the time in. Some days are really gonna suck, and I already know it. Overall, I've had a really good experience so far. I know there's gonna be some challenges ahead, and I'm definitely gonna share those with you guys, but I think just getting out there and not being afraid and really not holding back is the best way to learn. My best advice is to just not be afraid and just try to get as much experience as you can, and you know, over time, the more comfortable you're gonna be. And right now I'm definitely uncomfortable, but I know it's just gonna get easier and more familiar and more familiar. So overall, I'm looking forward to getting more time out on the floor and more experience. I have 2 more weeks of classes left. I will let you guys know how that goes. Thanks again for tuning in. Make sure you subscribe and like this video so I know to make more. And of course, if you have any questions, make sure you leave a comment.